Hello everyone. So in today's topic we are going to discuss about tissue regeneration or the stages of wound healing. So far we are discussing about the tissues, its types, everything. So it is the last topic, that is the tissue regeneration. So when a tissue is being damaged or when it is being dead or worn out, so at that time something has to be replace the dead tissue or the dead cells or something. So what is happening? The process is called as tissue regeneration. So this is our today's topic. So we'll discuss about it. So tissue regeneration. Regeneration is a type of healing in which the new growth completely restores the portion of damaged tissue and gets it to the normal state. So something which is the dead tissue or the tissue which is being destroyed or some damage is being happening to the tissue. So at that time something is restoring, some tissue is being growing into the lost tissue or the damaged tissue. So that process is called as the regeneration of the tissue. So now we can read, regeneration is a type of healing. It's a type of healing with which the new growth completely restores the portion of the damage. So each and every tissue in our body has its own function and own work. So at that time, if something is being damaged, at that time it has to be replaced by someone now. So when we are going to leave, when we are working in some place, we are leaving on that day. So our work is being given to someone to manage that place now. So at that, like that only, the regeneration is happening in our body. A part of organism's tissue that is being traumatized by external force or partially lost, and based on the remaining part, it grows in the same structure and function as the lost part. This repair process is called tissue regeneration. So when a tissue is being damaged or traumatized by external force like something accident or something, whatever, cut or wound or something which is being happening in our body, at that time the remaining part which is being nearer to the dead or the worn out tissue, it grows at the same structure and it replaces the functions of the lost part. So that process is called as the tissue regeneration. So the tissue regeneration includes the regeneration of epithelial tissue, fibrous tissue, cartilage tissue, bone tissue, blood vessels, muscle tissue and the nerve tissue. So these are the places where the tissue regeneration is being happening in our body. So there are three general categories. So these are the three categories how the tissues are being regenerated. They are being classified into three categories. They are tissues in which cell replication is a continuous process, regenerate quickly. So first one is they regenerate quickly. That tissues are being categorized as number one. So they are the epithelial cells, skin, mucous membrane, uterine lining, etc. So for the best example is uterine lining. So we get menstruation every 28 days. So each and every time the uterus shed its inner layer, and what happens in 28 days, again it grows back to its normal state. No, so again it's a continuous process. It grows, it sheds, it grows. So that is a continuous process. So that is categorized as number one. So number two is other tissue has the ability to replicate but do it infrequently. So some tissues do it infrequently. Once in a while they do it, but they can do it and they do it infrequently. So these tissues take longer time to regenerate. So here you can see it. For example, the uterus, someone will be having 28 days cycle or 30 days cycle. So whatever it may be, it happening within a month's time. So but here it takes longer time to regenerate. These include liver, kidney, smooth muscles. So these are the things where the tissue able to replicate, do it infrequently and take longer time. So some cells are normally unable to replicate, including the nerve cells, that is the neuron, skeletal cell and the cardiac muscle. So the nerve cells, meaning that the damaged tissue cannot be replaced. Extensively damaged tissue is mainly replaced by the fibrous tissue because the function of the original tissues are lost. So here you can see, here it can be never reverted back. It can never go. That cells are called the nerve cells, the neurons which is in our brain. So that cannot be replaced or that cannot be grown back. So that the skeletal muscle, the cardiac muscle, everything cannot be replaced. So what happens, the nerves are meaning the damaged tissue cannot be replaced extensively. So most of the time the extensively damaged tissue is replaced by the fibrous tissue. The fibrous tissue, it performs It helps the other cells which is being dead or the worn out. That cell is being replaced by the fibrous tissue, and it tries to put it effort to make the functions of the original tissue which is being lost. So that is happening because of this fibrous tissue. So these are the three general categories. One, it's a continuous process and it replicates continuously. That is the best example is uterine lining. The second one is they do it infrequently. It takes longer time. That is the liver cell, kidneys, and everything. And the last one is they cannot be reverted back. They cannot be replaced. But it can be replaced up to some extent by the fibrous tissue. So next one is the stages of wound healing. So when we are getting a wound or cut in our body, something is happening in our body, no? So some process is being undergone. There's some phases or whatever you call phases or process. So that is called as the stages of wound healing. So first phase is called the hemostasis phase. So this you can get it as a 5 mark as each and every single phase, or as a 20 mark question of the it has 4 phases. So all the 4 you can get it in a 20 mark question. So phase 1 is the hemostasis phase. Hemostasis is the first phase of healing, and this phase begins at the onset of injury, and the main function is to stop bleeding. I have made it into a simple English only so that it will be easier for you to understand. So if you are reading it twice, you can just understand this concept. So hemostasis is the first phase, and this phase begins at the onset of injury. When a cut or injury, something is happening in your body, immediately this phase starts. And the main function is to stop the bleeding. So what happens immediately when we are having a wound? For example, we are having a cut in a hand or finger or something. At that time, bleeding occurs. So what happens in hemostasis? First, the bleeding is being stopped. So in hemostasis phase, the body activates its emergency repair system, which is the blood clotting system, and it forms a dam to block the drainage to prevent the bleeding. So what happens is immediately our body is designed in such a way that when a cut is happening and the blood is flowing at that time, the body immediately produces a blood clotting system in our body. And it forms a dam to block. So how when we are taking a tumbler or something, a pot or something, there will be a small hole and the blood will be leaking in that. So what we do, we try to fix it with, we seal it with something, no? So at that is being done by something called the platelet. So we'll see in this. During this process, the platelet comes in contact with the collagen, resulting in the activation and aggregation. What happens when a bleeding is being happening? The platelet, it just forms a mesh like something. It forms as a block. And prevents the blood from flowing, and it just seals the place where the bleeding is happening. So there is an enzyme called thrombin which is at the center, and it initiates the formation of fibrin mesh which strengthens the platelet clumps into a stable clot. And here you can see the fibrin. That is an enzyme called thrombin in our body which forms a fibrin. So these two forms a fibrin mesh like something, so that it is being sealed into a stable clot. Stable in the sense it's being just strong enough to hold the blood from flowing out. So that is being happening by the platelet and the fibrin. So this is the process which is happening in the hemostasis phase. So second is the defensive or the inflammatory phase. So as the name says, that defensive, something which is being protecting our body from something, and the inflammatory phase, some inflammatory process is happening in our body. So if the phase 1 is primarily about coagulation, the second phase, called the defensive or inflammatory phase, focuses on destroying the bacteria and removing debris, essentially preparing the wound bed for growth of the new tissue. So what is happening is in the phase 1, it is about the coagulation. Something is being clotting, no? But in the defensive or inflammatory phase, it is destroying the bacteria and removing the debris. Debris means the remaining part which is dead or worn out, which is not needed for the body. That is called the debris, which is to be eliminated from the body. So that things are being cleared out in this defensive or the inflammatory phase, which helps for the growth of the new tissue. So during phase 2, the neutrophils, which is a type of WBC, enters the wound to bacteria and remove debris. So what happens? neutrophils. As you can see here, this is a neutrophil which is entering the body, and it is the one which clears the removes the bacteria and the debris. So the neutrophil is a type of WBC, multiplies at the wound site between 24 and 48 hours after the injury, reducing greatly in number after 3 days. So what happens immediately between 24 to 48 hours? First the clotting will be happening. Immediately the neutrophils comes there and it removes the bacteria and the debris. So it happens between 24 to 48 hours it happens, and it greatly reduces after 3 days. So this is the first thing happening. So what happens next is that as the WBC, the white blood cells leave the site, a specialized cell called macrophage arrives to the continue for the clearing of debris. So as you can see here, the neutrophils and the macrophage. So these both are helping in the defensive or the inflammatory process. So first the neutrophils comes, and then it goes the macrophage comes. So the macrophage also secrete a growth factor and protein that attracts the immune system cells to facilitate the tissue repair to wound site. So what happens in the macrophage? It again cleans the it produces the growth factors and protein that attracts the immune system cells. Immune system in the body, or immune system cells are being present. So that is being attracted by this macrophage, and it also facilitates the tissue repair. By how it is being facilitating in inflammatory phase, it lasts about 4 to 6 days. It is mostly associated with edema, erythema, or the reddening of the skin, heat and pain. So normally when we are getting a wound or injury, you can see that edema, swelling sometimes will be there, or erythema, the reddening of the skin will be there, heat, we can feel some warmth over that place, and pain will be there. So these are the 4 things. So what are so the neutrophils and the macrophages? It helps in removing the bacteria and the debris, and this inflammatory process it can be identified by swelling, pain, warmth, and red. So you can see the macrophages comes and clearing the debris. So this happens in the defensive or the inflammatory phase. So third phase is the proliferative phase. So when the wound is cleaned out, the wound enters the proliferative phase, where the main function is to fill and cover the wound. So everything is being cleared and it is set for growing of the new tissues. That is being happening in this proliferative phase. So covering of the wound should be done. So the proliferative phase has 3 distinct stages. They are filling the wound. So wound should be filled. Contraction of the wound. So when you can see that when we are having a cut, there will be a split between 2 edges will be there. So that has to be closed, that has to be contracted, no? So margins of the wound has to be contracted. So that happens. And covering of the wound. So above that, a covering should be done to make both the wound margins to be set as the normal one. So that is called as the epithelialization. These 3 processes happening. What is the filling of the wound, contraction of the wound, and covering of the wound? That happens. So here, as you can see here, there is a wound is being present, the new blood vessels are being regenerated, and something is being filled in this place, that the granulation of the tissue is happening. So these are the things which is happening. So we can discuss in detail. So during the first stage, that is the filling wound, a shiny, deep red granulation tissue fills the wound bed with a connective tissue, and a new blood vessels are formed. As you can see here, the granulation tissue you can see here, and a new blood vessels are being formed. So during the second stage, the contraction of the margins, that is the wound margins, contract and pull the margin toward the center of the wound. So what happens? These wound margins will be contracted. They are pulled towards the center, so that it closes, and the healing process will be moved to the next level. So the third stage, the covering the wound, epithelialization, that is the epithelial cells arise from the wound bed or margins and begin to migrate across the wound bed in a leapfrog fashion until the wound is covered with epithelium. So what happens? This is the epithelial cells multiply and fill over in the granulation tissue. The epithelial cells will be formed, will be arised here, and what they happen is a leapfrog fashion. So how a frog will be jumped from one place to other, it will be leaping, no? So like that, the epithelial cells will be leap from one over the other and cover the whole wound, and the margins will be closed. So that is being helped by this epithelial cells. So now we can read in third stage, the covering the wound or epithelialization. The epithelial cells arise from the wound bed or the margins and begin to migrate across the leapfrog fraction. So they will just complete this wound bed, and they will fill this place. until the wound is covered with epithelium. So the proliferative phase lasts from 4 to 24 days. So first happens is the granulation of the tissue. It happens and the wound margins will be pulled toward the center and epithelial cells will be filling the wound in a leapfrog fashion to cover the open wound. This happens in 24 days. So last one is the maturation phase. So first is the hemostasis phase, second is the defensive or inflammatory phase, third is the proliferative, and fourth is the maturation or the remodeling phase. So this is the last one. So healing begins with hemostasis. Healing first it starts with hemostasis, and during the maturation phase the new tissue matures slowly and gains its strength and flexibility. What happens here? It gains its it tries to gain the normal strength and flexibility. So the collagen fibers reorganize the tissue and remodels and matures. So what happens? The collagen fibers inside when, for example, when we are getting a new visitor to a house, they have to adapt to us. We have to match with everyone, no? So like that, it is like a new thing, no? So it is coming inside. It is being formed newly inside the body. So it has to be recognized by each and everything of the body, and it has to mature. So that is happening. The collagen fibers happening in this maturation phase. There will be an overall increase in the tensile strength through the maximum strength is limited to 80% of the pre-injured strength. So whatever happening in new tissue is happening, so it can be performing up to 80% of the original tissue, because it's something replacing that. It can't be replaced completely. It is the strength of the new tissue will be up to 80% of the strength of the old one. So in the maturation phase, the healing time varies greatly from wound to wound, often lasting from 21 to 2 years. So if the wound is very small, it can last in few days or months time. But if it's a big wound, it lasts up to 2 years. Completely the healing and the maturation, everything, it can be leading to 2 years. The healing process is remarkable and complex. It is also susceptible to interruption or due to local and systemic factors including moisture, infection, maceration, local and age, nutritional status, body type, systemic, etc. So here healing process, it can be affected or interrupted, and it can be altered due to from body to body, age to age, or sometimes if the moisture is there, infection can happen, maceration, or something according to a nutritional status. If a protein intake is not there, the tissue formation will be more or less, and the age for old age people, the tissue regeneration, everything happens very slowly. But the body time each and every body type is different, no? So this can be altered. The healing process can be altered according to these factors. It can be a little delayed, or it can be, if everything is proper, it can be very early for some people. When the right healing environment and process is established in the body, it works in wondrous ways and can replace the devitalized tissue. So if the healing environment, all these things are very normal and it is very proper, this process works in wondrous ways and can replace the normally devitalized tissue, can be replaced very quickly. So it happens between 21 days to 2 years, no? So sometimes it can happen between a month's time or 6 months or anything. So like that, it can be happen very early and quickly. So this is, we are concluding. So 4 phases: hemostasis phase, inflammatory or defensive or inflammatory phase, proliferation, and the remodeling or the maturation phase. Here, as you can see here, epidermis, the first layer, the middle layer is the dermis, subcutaneous layer. So here the blood vessels, that is being, blood supply is being provided here. So first what happens, the fibrin and the platelet, they form a mesh-like thing, and the neutrophils and macrophages, they will clear the debris and the bacteria, everything. And the next you can see, the granulation of the tissue happens, the epithelialization happens, and they will start growing. The new blood vessels will start growing, and the blood supplies will be restored. The last is the remodeling phase. The collagen matrix will be matured and will be adapted to all the other blood vessels and all the system in the body, and they slowly regain its strength up to 80%. So these are the 4 phases of the wound healing. So thank you so much. I've also made this video in Tamil. If you want, just have a look on it. And to the next topic, we'll see about a new topic, and it will be so interesting. So please keep watching my videos. And also posted the same content in a blog, in my blog, that is the blogger website, the same named as Nursing Abstract. Just have a look on it. So thank you so much.